Thank you, Simon. As Simon says, I'm the current chair of the Private Hospital Association, and I'll be handing over to my colleague Margaret Swords after the Minister has spoken. So today, welcome to our first, hopefully of many, conferences by the Private Hospital Association. I'm just going to spend a few minutes telling you who we are and what we do. I want to frame the conference by talking you through the challenges I think we face. And as we all know, a challenge is really an opportunity in disguise. I want to tease out a few discussion points for the conference and a few of the themes that we want to introduce today and give you a very quick outline of your programme. You should all have this here in front of you. And then my most important job here is to introduce our Minister and perhaps make a few points that the Minister might address during his opening remarks. Who are we? These are all our members. I think you'll have met some of the colleagues in the room, and what we do, we're a nationwide network of 19 hospitals. We're all internationally accredited by JCI, and Paula Wilson is one of our speakers today. I look forward to hearing Paula speak, and indeed all our speakers. What we're about is delivering 24-hour acute and mental health services. And just to give you some statistics to put us into context, last year we delivered over 1 million bed nights. We saw more than 400,000 patients and did a staggering 3 million diagnostic tests. So a key part of the overall health system, and we're an employer of over 8,000 staff. And our proposition is we're part of the solution to all the challenges facing our health system and want to play an active part in that. When I was looking at the best way to frame the challenge that we face, and hopefully you can read all of that there, I thought the best place would be to quote our new Taoiseach, Taoiseach Leo Varadkar, and this was one of the first things he mentioned, and I'm sure Minister Harris would be very aware of this. No country has a perfect health service, and I think we'd agree with that. But he goes on to say, Ireland is an outlier among wealthy countries when it comes to patient charges and patient access. And that's something we know very well. And he argues that a country and political system that has managed to weather the worst recession in a generation, rescue the banking system, and end a conflict that's lasted for centuries, then surely that should be able to address this matter. And that he is determined, as Taoiseach, that we should do so. The Sláinte Care report that we've all seen that was recently published is now tasked Minister Harris with preparing a detailed response to that, amongst other things, including some proposed measures and timelines. And that's a key theme for our conference here today. So there's discussion points that I'd like to see us address. And some of you may have heard Simon Nugent this morning on News Talk about the investment plans for the country and to what extent the private sector would be involved in making such investment. Our continuous journey of quality and safety for our patients, how do we continue to make improvements in that? In particular, I'd like to see some discussion, and we have a panel session on that at lunchtime, on public policy direction following the publication of Sláinte Care, and following up from that challenge presented to us, how do we address Ireland as an outlier? How do we improve that position? And we also have our private health insurers here today, bearing in mind the demographic challenge we face, the ageing population. What's our direction of travel for health insurance, and how do we address the needs of our patients? So today's programme, and as I say, it's in that little booklet there, I'm shortly going to welcome the Minister to give the opening address. Then we're going to be talking about planning and investing. We're going to be talking about continuous improvement. We're going to be talking about the future of healthcare and of private health insurance. And then in the afternoon, a number of the private hospital association members are going to be showcasing some of the innovations in our private hospital. And some of those are really, really important, and I'd encourage you to look at those. So, my last and most important duty, though, is to welcome our Minister. And we're delighted that Minister Harris is here to open this conference. Simon was reappointed Minister by the Taoiseach just last Wednesday, and having previously been appointed by Enda Kenny back in May 2016. By then he'd already spent 5 years in the Dáil representing the people of Wicklow and, of course, the easterly reaches of Carlow, perhaps the most important county in the country. When God made Carlow, he was only showing off. In 2014, he was appointed a Minister of State in the Department of Finance, and hopefully that's given him very valuable experience to work with his new colleague, Minister Donoghue, as he tries to secure funding for the health service. And we wish him lots of luck in that regard. So I'd like to congratulate the Minister on his reappointment. A number of us, in fact all of us here, will have witnessed his energy and his commitment in his first year in office, and we really do look forward to working with you to make a real difference in the coming year, particularly from the framework and that initiative you introduced early on. So by way of a few open remarks and points I hope that the Minister can address, I just want to cover 4 brief things. One, the Private Hospital Association is really now looking for a commitment to progress and, above all, a bias for action. We welcome the Sláinte Care report. What we'd like to see, though, is the ambitions in there turned into early action as the challenge given by the Taoiseach, with some detailed planning and with the development of an all-party inclusive strategy to improve our health service. And that strategy, I think, must and should include the Private Hospital Association, given the capacity that we offer, given our place already in the healthcare service. We'd also like to see some serious joint planning as we make some commitments towards investment in more public hospitals and private hospitals, as we look to recruit more consultants to meet the various vacancies. I think there's over 300 vacancies in the public health system at the moment, and the demands on the service are only growing. But also a real commitment, and I know something that's very dear to the Minister's heart, to the collective management of waiting list, to reduce the amount of time that all of the patients are waiting on there, and giving realistic plans in place to deliver that in a partnership approach with the private hospital. To help us do that, we'd like to see an early commitment to one of the key planks in the Sláinte Care report, which is the disentanglement of the private patients being seen in the public hospital. We think that will have significant benefit in that it will free up the capacity in the public health system to help address the waiting list, and it will give us the opportunity in the Private Hospital Association to gear up, Minister, to help address those challenges. And the last thing, and again it's about this emphasis on partnership and planning and process, that we would like to see some streamlined long-term planning. We all welcome, Minister, the reinstatement of the NTPF, but we're very saddened with the lack of progress so far. We appreciate the significant management changes in the NTPF, but I'm concerned that your targets that no one would be waiting over 15 months by the end of June might not be achievable given the late start. Rest assured, the Private Hospital Association and all its members stand ready, and we'd made capacity available, and it's just unfortunate that that didn't get going as quick as you would have liked. I know that you're going to work hard to fix that, and that's going to be especially important for next year. We welcome your commitment of another 55 million next year, but we hope that that process gets going now for 2018 if we're going to make a real difference. That's all I wanted to say, and other than to welcome the Minister to officially open our conference. Ladies and gentlemen, Minister Hart.